everyone. Today is Wednesday, May 19th, and it's Dr. Wendy Fortna here with a COVID-19 update for Hanna and Special Areas. Right now we have 7 active cases in Special Areas number 2. I had a request for some more statistics from our area. So in total, since the pandemic started, we have had 90 cases. Of those, 50 of them have been in this third wave. There is no public data right now about the number of days that individuals from our area spent in the hospital. We have had 1 death. Because we're such a small community, I'm not going to release any additional information about that death in order to maintain the privacy of the patient and their family. I'm excited that now vaccines are available for all Albertans over the age of 12 and looking forward to a time when the studies on children are completed and our young people are also going to join those ranks. Right now, we are not doing vaccinations at the Hanna Public Health Office. The public health offices surrounding us in places such as Drumheller, Oyen, Stettler, those places are being marked for vaccination, so people are continuing to travel there. You'll have to check with a local pharmacy, PharmaSave here, to find out which vaccines they have and whether or not they have any in stock if you're looking to book an appointment locally. I had 2 questions this week. The first one was about pregnancy and the COVID-19 vaccinations. I can't believe it's been an entire year since we did a talk about how COVID-19 disease affects pregnant people, but it has been. So since that year has passed, we've had a lot more information because more pregnant people have been showing up both in vaccinated groups as well as in those affected by the COVID-19 infections. You are noticing right now likely that as we are getting more and more cases, especially in young people, there are more pregnant women ending up in the hospital and in the ICU. We know that pregnant patients who get COVID-19 are more likely to have complications during that pregnancy, such as preeclampsia, stillbirth, preterm birth, NICU stays for their baby, as opposed to mothers who do not acquire an infection during their pregnancy. We know that the more severe infection you get, the more likely you are to have complications for yourself or for your baby. The risk of a bad infection is higher in people who are obese, have hypertension or high blood pressure, type 2 diabetes, and those who happen to come from a Black or Hispanic background. These are similar risk factors to the general population for severe disease. When it comes to what the risks of vaccination are in pregnancy, that's a little bit trickier. If we look at the initial studies that randomized people into getting vaccine or getting a placebo and not knowing which one they received, they recommended that pregnant women not be a part of the study and that people avoid planning a pregnancy, but there were some pregnancies that occurred by accident in these groups of individuals, and what they found was that in the study there was equal rates of miscarriage and complications in those who received the placebo and those who received the vaccination. That would indicate that the vaccine is not responsible for side effects such as miscarriage. There's a large post-market evaluation study of over 20,000 women in the United States who received a vaccination and self-reported a pregnancy. They are tracking their side effects through an app that's available down in the United States, and it's been very reassuring that the effects that are happening in that group, the birth outcomes, are essentially identical in rate to studies done before COVID ever existed. So that being said, things like miscarriage, preterm birth, low birth weight babies, the rates in people who receive the COVID-19 vaccines, and in this moment I'm only speaking about the mRNA vaccines, were exactly similar to the ones that happened, say, 4 or 5 years ago in pregnant women. The same percentage miscarried, the same percentage had stillbirths, etc. So more evidence saying that there is no significant side effects to the developing baby or to the mother outside of the general population. When we consider what the potential benefits of vaccination might be, certainly to protect against infection for the mom and therefore the outcomes of an infection for the baby. There may be some results of infection prevention in breastfeeding, where some of the antibodies can be passed through the breast milk after the baby is born. So we are encouraging women who are breastfeeding to receive the vaccination. When it comes down to making a decision for yourself, what you're going to do during your pregnancy, it's always going to be an analysis of the risks versus the benefits. I would want you to consider what your risk is of acquiring an infection. Do you live in a high transmission zone right now? Do you have a job that puts you at increased risk of encountering populations that have high risks of disease? Do you work in healthcare? Do you work in a public service industry, such as at a grocery store? What kind of social activities are you choosing to engage in? And what kind of activities is your partner or other people living in your homes engaging in? We know that most people acquire their infection from a loved one, not from a stranger. And so if you have a partner with a high-risk industry, you may consider yourself at higher risk of acquiring an infection as well. You may want to consider whether or not your risks of having a serious infection are higher. Are you an obese pregnant female? Do you have pre-existing high blood pressure or diabetes? That could make you at a higher chance of having a serious infection and therefore bad outcomes for you or for baby. It's important that you're comfortable with the idea of a vaccination itself and knowing that we haven't studied people for long periods of time. I'm quite reassured by the data that we have, but it is very much a personal choice what you want to do during your pregnancy. I always will encourage you to talk about it with your healthcare provider if you want to discuss the risks and benefits for yourself more clearly. The second question that I received was concerning the letters of exemption from mask wearing and whether or not it's a violation of a person's medical privacy, particularly a child who has an exemption. I want to reassure you that the instructions that we as healthcare providers have been given are to issue a form letter that does not reveal the specific diagnosis that you or your child may have that exempts you from wearing masks. It simply says that we are qualified to certify that you have an exemption and that this is the list of exemptions that are available. So no specific data is revealed. So you can rest assured that your personal medical information is going to remain private between you and your care provider. I want to thank you for your attention for these posts, I guess, that we've been doing. I had always told myself that I would be done these posts as soon as every adult could get a vaccination that wanted one, and we are there. So thank you so much for your months of attention. I encourage you to continue to have a good, open relationship with your healthcare provider. This is our last COVID-19 video. Thank you and goodbye.